enter the room.
Hello, I'm one of the F2s in this department. Before we start, can you please confirm your name for me?
Doctor, my name is James Clark.
And is it okay if I call you James?
Yes, that's fine.
James, can you kindly confirm your age for me as well?
I'm 53, Doc.
Okay, it's nice to see you, James. I can see that you're here because you want me to discuss your biopsy results. Am I right?
That's what I came for,
Yes.
Doc.
Okay, so I'm going to definitely discuss your biopsy results with you shortly. But before that, I just want to know a few things from you, how you're doing at the moment, James.
I'm not sleeping so well, Doc. I normally I have disturbed sleep because I'm always having some reflux at night.
I'm really sorry to hear about that. And can you tell me for how long have you been experiencing these symptoms?
This has been going on for a very long time, Doc. That's why they did the investigation. That's why they did the test for me.
Okay. And is it the first time that you've been experiencing these symptoms?
No, this is not the first time I'm experiencing this, Doc. I've been managed for GERD.
Okay. And for how long have you been managed for GERD? And is there any medications that you're taking regarding it?
Yes, I've been managed for GERD for the last 5 years, Doc, and I've been taking omeprazole.
Okay. Do you also remember the dose of your medication?
I think it's 20 milligrams. Yeah, I just take one tablet a day.
Okay. And taking the medication, is it helping you with the symptoms?
My medications were working, but recently it's no longer doing much for me. I'm waking up at night because I have so much discomfort in my chest. Yeah.
I'm so sorry about that. James, do you have any other long-term medical conditions?
No, I don't.
And do you also experience any fever?
No, doctor, I'm not feeling, I don't feel like I am running a temperature.
And do you have any difficulty in swallowing?
Yeah, it's
Okay.
not
And
like
have you noticed?
with swallowing. It's mainly that, all that food comes out. I've been experiencing this reflux very often.
I'm so sorry about that. And also, have you had any episodes of vomiting?
No, doctor, not as such.
And any changes in your appetite?
Well, I don't really eat that regularly. You see, I'm like a pizza delivery man, and my work hours are very irregular.
Okay. And can you tell me more about your eating pattern? At what time do you usually take your meals, and what type of food do you usually have?
I usually eat junk food. I get food from the restaurant itself, and well, whenever I get the time, I eat.
Okay. Okay, I completely understand. And are you smoking?
I usually do smoke. Yeah.
And do you drink alcohol as well?
Yeah, I do.
Okay, can you tell me the frequency of your drinking and what type of alcohol do you drink?
Yeah, I usually drink beer, about 3 bottles daily. Yeah.
Okay. And do you have any idea what might your is there anything in like do you have any idea what might your biopsy results show?
Nothing, doc. I mean, I'm actually hoping to understand, what could get this condition better.
I completely understand. Is there anything in particular that's concerning you?
Yes, mainly the sleep. I've been having very disturbed sleep.
I understand. And is there anything else that you would like me to do for you today?
No, doctor, I'd just like to hear what the biopsy says.
Okay. So thank you so much, James, for having this discussion with me. So let me explain to you what your biopsy results show. So you came here to the to the department 2 weeks back to get an endoscopy, and we took a tissue sample, right? And we sent it to the lab to get it tested. So the biopsy test results show that so there is some changes in the lining of pipe, which we call in medical terms as metaplasia, and this condition is called as Barrett's esophagus. Would you like me to explain more about it?
Yeah, what does that mean? What does that mean for my health?
Okay, so let me explain to you what this is. So you mentioned that you've been having a history of GERD for a very long time, and you've been taking medications for it, and you have been constantly experiencing this refluxes. So when this goes on for a very long time, so there is certain changes in the lining of the food pipe. So if this goes for a very long time, unfortunately, it can, with time, it can become a little serious condition. But right now, let me assure you that there is nothing to worry about. It is nothing related to a cancer. Okay, it's not cancerous at this moment, but we do need to keep monitoring you, and we do need to keep up some check on you. So would you like me to discuss the management plan further?
Yes, yeah. I mean, you said it's going to become
Uh,
cancer. Like, how can I prevent that from happening?
Yes, so what we first very important thing is that so your biopsy results shows that the metaplasia, the changes has occur at it has involved 5 centimeters of your food pipe. Okay, so that means that it hasn't involved a significant part of your food pipe. So this if right now you need to come to the clinic every 3 years to get an endoscopy done. We need to keep following up with you for we need to do these endoscopies every 3 years to check for any changes in your food pipe. Okay, and one important thing is that regarding your diet, we are a little concerned. You mentioned that you've been having junk food and you've been drinking alcohol a lot as well. So unfortunately, these food habits can, increase the chances of you causing more harm to your food pipe. So I would advise you, James, that please try eating healthy, balanced diet. Have You can have small, frequent meals. Don't overeat, and also please cut down on drinking alcohol. Is this something that you would be able to do?
I mean, yeah, I mean, if it's so dangerous, but
Hello.
can't it be something stronger? Can you hear me?
Yes, and regarding the medication, we will increase the dose of your omeprazole from 20 mg to 40 mg so that it will help you with the symptoms. And I will offer you a leaflet for more information. Thank you.
All right. Good job, Dr. Mishi. I understand there was a
Okay.
glitch in the system with regards to, having that seamless consultation. But all
Yes.
right. Good job in
Okay.
the thing, the whole consultation. But I'd like to say a few things. You this is a counseling station where you already know the diagnosis, so you spent a lot of
Yes,
time.
I'm again doing the same mistake. Yeah, I know I'm doing the same mistake again.
I mean, the main thing. So, what do you think should be the main questions you need to ask in with regards to this?
Just rule out few cancer symptoms and his heating habits and the medication and like is it helping? That's all. And ice.
Some triggers, because the main thing is you need to understand, even with the medication, why is it not improving, and actually having
Helping.
nighttime symptoms is actually pretty bad. That means the what to say, you need to give him something a little bit stronger. So that's when you actually have to understand, is he compliant with his medication, how was his medication offered, right? That so what are the other triggers that he is having, right? So to understand what to offer him as management. And how would you explain this particular case as, for regards to it becoming cancerous? Like, I know it's like that borderline between a precancerous condition and it becoming cancerous. So, you can't tell him that there's not much something to worry about. There is definitely something to worry about because it is, a precancerous condition. So from here on, it depends whether it actually improves or it worsens, right? So you have a chance for it to improve. So you have to stress upon the fact that from now on, we need to be very adherent to your lifestyle, improvements, as well as, making sure that you don't have more of these refluxes. So when does this metaplasia actually happen? Like, why does this metaplasia actually happen? Anybody?
It yeah, because of the frequent acid refluxes, it changes the lining of the from columnar to squamous epithelium. It's the acid is actually damaging the lining.
Absolutely.
Acid reflux.
Dr. Anuti, you have something to say? Dr. Anuti? Hi, Dr. Anuti, I can't hear you. All right. So absolutely, that is the thing that is actually causing the change in the cells. So that's exactly what you have to tell him, that, because of the frequency of your acid reflux, this has been happening, right? So in order for it to not get worse, we have to somehow reduce that. And the medication that I'm actually giving you usually does reduce that, but we need to review the medication to understand whether we need to change it or increase the dose. What if omeprazole itself is not working, right? What if you have to, with a PPI, you also have to put an H2 also, or, some other medical management. So do mention it like that, to understand, what is your main purpose over here? Your main management is to reduce the reflux. And the main thing that you can do to reduce the reflux is actually the lifestyle management. To have regular meals, to cut down on smoking, to cut down on alcohol, because these are all right. And it will just worsen the condition no matter how much medication you have. So you need to make sure that, they don't have any more triggers. And then go on to talking about the medical management. So towards the end, your time was very limited. Do you understand? So, you
Yes, yes.
get everything out. So that's one thing that I was, this is one station again where I could, you could actually use that, where, you explain the condition, you explain the seriousness of this condition, you explain why it is important to, start leading a healthy lifestyle and, take medications to improve the reflux, right? And then
Right.
you can go on to saying that I can give you some lifestyle measures. I can talk about the medications. I'd like to give you some leaflets and pamphlets so that, you could keep all that we have discussed with you. And I'd like to arrange a follow-up to see how you're doing. And then you can also talk about the fact about the review. That was a good point that you added on, right? We need to, because it's actually mentioned here. So
Yes.
whatever happens, you have to do the task, what you're expected to do. Then you have to
Right.
talk about this review as well. So say that in one go, and then ask them, what would you like to talk about first?
Okay.
So that,
Okay.
you have only 1 minute left, and yet
Mhm.
you are kind of making the examiner aware that, these are the different aspects that I will be touching upon for this particular condition, right?
Right.
So
Okay.
yeah, that would guarantee you some marks, right? And then talk about the, what to say, the safety netting as well, some cancer science to
Yes.
any issues in swallow,
Yes.
right? That was
Okay.
good.
Okay. Okay.
So
Hello.
yeah, Ashish, were you able to yeah, awesome. So let's just quickly look at the scores. All right, so we have, your data gathering was pretty good. Ask about any other symptoms such as weight loss, difficulty in swallowing, or pain. I think, yeah, I think weight loss and swallowing was good enough, Like you're looking for any strictures or, any cancer symptoms, right?
Mm.
about compliance with omeprazole and any side effects. Yeah, side effects is also an important thing that you can mention. Omeprazole, by the way, is a liver enzyme inhibitor. All right, management. Let's just quickly look at the management. I think you could have said more regarding the metaplasia. So when you're talking about metaplasia, that's the main thing that you're trying to point out to this person is that this is a precancerous condition. So the metaplasia meaning that the normal cells that are lining your food pipe are getting disrupted because of the GERD or the acid reflux that you have been experiencing, right? And we have to focus on reducing that in order for it to not progress into becoming cancerous. You know, that is a good way to actually express that. So our
Okay.
efforts for today's consultation will be focused on how you can do that. Yeah.
Okay.
So
Okay.
that's the need for this was good. Good job on doing that. And explain the biopsy results. I think you were explaining the biopsy results over and over again. I think you spent a lot of time in doing that. You actually explained it to me 3 times.
Okay.
So, you know, try to keep it crisp. Try to hit the point right in the beginning itself, and then go on to management. Yeah.
Okay.
So advice
Okay.
on lifestyle modification, quit smoking, alcohol, provide written. So that's what, no, you understood all these as factors. So bring it back in management.
Right.
Change jobs, Dr. Anote is asking. Yeah, you can actually advise him to change jobs as well. Yeah, that's actually a very good advice. You know what? I'll take it down. That is also something you can offer him. You know, if that is something that is not allowing you to eat properly, that is something you can offer him.
Mhm.
How about you
Okay.
think, you know, if you'd like, I can help you with that aspect as well, right?
Okay. Okay.
One important thing that I want to tell you guys, whenever there's an investigation, yes, Dr. Sana, you have something to say?
Hello, Dr. Khan. I wanted to
Right.
ask that during the consultation, if the patient says that ask us something and we have already told that before, so do we tell the patient that I have told it before, or do we just explain it again? How do we tackle that?
Definitely have to explain it again. The patient is not getting tested. I mean, this is what they are also trying to see your interpersonal skills, right? Like, even if there are some cases, there is one where, you know, there are cases where, you know, there are patients who are mentally challenged and you're supposed to do a consultation with them. So most of the time, after you explain them something, they'll be like, what? And when you're like, do you understand what I'm saying? And they'll be like, what? So you have to keep explaining it to them. You have to test their knowledge to understand how much they understood. You have to correct them when they're mistaken. So that is one important aspect we're actually trying to check. Even if they haven't understood, you know, try to say it back by paraphrasing. You know, try to say it in a different way that they might understand. Maybe how you put it wasn't something that they understood. So the patient always has the benefit of the doubt, right? So you have, it's your prerogative to actually explain it to them, you know, however they, you know, would understand it, right? And if you say, I've already explained it to you, you lose a lot of marks in interpersonal skills, doctor. So try not to do that. The patient might say that to you, though, you know, but you'll be like, all right, sure, why not? All right. So provide written information. Yet towards the end, you somehow got it across the line, Dr. Mishri.
Mm.
Yeah.
Yes.
Can I say something, please?
Yes, doctor. If you would like to say something, it would be better if you raise your hand. But yes, go ahead.
Okay. I just faced the same question in my PLAB examination. I just recently, about 2 days ago, I had my PLAB, and the
Okay.
same, yeah. So I got, it was just by chance that I entered into this, but I liked it. First of all, I would highly appreciate the candidate because her structures was very nice. She was asking question very clearly, but she was too slow, you know. That was one thing which was, and she was not keeping pace with her consultation. She took too long to reach to the management, and I highly appreciate whoever is the facilitator had given a wonderful feedback. You know, I'm really impressed by the facilitators whoever you are, you people are. So, but just one thing which I just have slightly I disagree. I'm sorry about that. Is that to change the job, because changing job I would not, but rather if you tell him that you please try and think about your diet, maybe you can prepare something at home, you just carry with you, because now everything is going to be very important, and that your food, moreover, the smoking was not taken it, the risk, the amount of risk that smoking carries with any cancer or Barrett's esophagus, it's immensely a lot. You have to pay a lot and lot of stress on smoking, as well as she said, the patient said that he had been drinking a lot. So those factors were very strong risk factors, and they must take a lot of priority in the management part. And I think the rest of the things were wonderful. I enjoyed it, and I'm sorry if I took your time. Thank you very much.
No problem, doctor. Thank you so much for your insights. Absolutely. And we completely agree with that. Actually changing jobs is definitely a big, step. And, if there is something that you can do before that, definitely we can try to implement that. Thank you so much for that, suggestion. We will definitely try to implement this. And doctor, we would really like it if you can join our WhatsApp group and, do share more, pearls of wisdom. So we'll just be
I will
dropping.
try to do it. I will try to do it. Inshallah.
Yeah. So yeah, we've just dropped it on the comments, so you can join in from there. So yes, so like we discussed, definitely risk factors, and then review medications to see their effectiveness and adherence. If you want to add on something, or you want to change the medication to something stronger, right? And safety netting. So if at all you feel that you are finding it difficult to swallow, if you're having severe chest burns, yeah, so all of those things, if you do start experiencing, please do come back to us or seek medical help as soon as possible. So amazing, Dr. Mishi, good job on that. And interpersonal skills, simple language. Yep, you were definitely, you dropped the word of metaplasia, but you explained it. You told them that there was a change in cells in the lining of the food pipe, and you explained that well.
Which we call metaplasia. I said like that.
Yeah, that was good. That was good. One more thing that I'd like to add to the interpersonal skills is you understand that this person has come from an endoscopy. And endoscopy is such a difficult procedure, right?
Difficult procedure. Yes.
So the first thing you can actually ask him is, how did it go? How was that procedure? Right? Are you comfortable?
Yes. Important question. Yes.
Right.
Yes, yes.
Acknowledge the fact that something like that, a very uncomfortable procedure like that has happened. Ask him how it went. Address any concerns that he might be having regarding that. So do keep that in mind. Understand where this patient is
Yes.
actually coming
Yes,
from.
yes.
So
Definitely.
good job. I'll actually add it in this case as well. Right.
Okay.
All right then. Good job, Dr.